All right. Hi, everyone. Welcome to the Healthcare Marketing Executive Podcast for Outcomes Rocket. Have another really special guest for you here at Health 2025. Welcome.
Thank you.
So thrilled to have you on. And, for our audience listening in, on podcasts and social media, listening to this video, introduce yourselves to us in the audience.
Yeah, my name is Robbie Dorius. I'm the head of media for health.
Amazing. How has health been for you so far?
It's been really fun and exhausting and elating. It's just been a whirlwind of a week, but one that is very memorable.
I love that. I think for so many people that I speak to here at the event, health is such a pinnacle of the year for them. It's the place where they come to learn about, news happening in the industry. They're hearing the new buzzwords. They're seeing new tech and innovations on the floor. There's so much going on. So actually, I'm sort of curious to get your perspective. Has there been anything that's really jumped out at you this year in terms of being innovative? What have you seen?
Yeah, well, obviously AI is dominating the headlines across the US on all sectors of business, but certainly within healthcare. And I think that you're seeing an increased conversation on implementation of AI to streamline healthcare. What I think is interesting is seeing how each company approaches it.
Yeah.
What I'm particularly paying attention to is what are the guidelines or the guardrails that they're putting in place.
Yeah.
And I'm listening to the talking points, and a lot of them are the same in terms of putting an advisory board together, but I want to know what that means.
Yeah.
And so while these innovations are great, I also am hoping to get a little bit more out of the governance of what that looks like as well. So that's what I find interesting, and I kind of keep my ears open.
I love that. That is such a good point. We've seen so much in the last couple of years, this boom of AI and this real excitement around it. And I've heard that sort of similar sentiment from a few other folks just saying, hey, we of course want to go leaps and bounds, but how can we also stay within the realms of safety and trust and making sure everyone feels bought in?
Right.
So that's such a good take. One of the things we always ask people on healthcare marketing executives, because I think one of the things Saul and I talk about a lot is comms folks, marketing folks, you're tasked with reaching consumers, making them feel bought in, but you don't often get this opportunity to speak about what you do and kind of sort of get that spotlight.
Yeah.
So I'm curious if you have any words of advice or if there's anything you wish folks knew about healthcare marketing as a whole.
Yeah. Well, I'll say it this way. I got the opportunity to speak with Mark Cuban this week, which is really fun, and do some rapid fire questions with him. One of the things I said to him is he has a skill to take complex issues and distill them into tangible and understandable terms that we all can just take in and understand. And to me, I'm interested in, from my side of healthcare, how can I make it more easy to understand? Where others within the healthcare industry may be focusing on how can I make this more easy to experience, whether it's through technology or at the pharmacy or whatever it may be. So I view my role as a media personnel as helping make healthcare simple for people to understand as well. Because listen, I'm 34. Every year, I end up calling my mom and asking her which health plan I should sign up for. I should be able to know, right? And we just need to be creating conversations where it's more tangible for people. And so that's really what I'm passionate about specifically here.
I love that. And I think it's such a task because I hear a lot of other marketers and sort of leaders in healthcare talking about, digital literacy and healthcare literacy. And it's sort of this goal of bringing consumers up to a certain level of education and learning and knowledge. But I often sometimes wonder whether we should really be doing the opposite, which is exactly what you're saying. Language and communications and engagement that anyone of any background, of any level of literacy can really tap into.
I wonder, even how many Americans know the difference between Obamacare and ACA and Affordable Care Act?
Yeah.
They probably think that those are three different things. Yeah. It's all the same thing. And I remember when I got into healthcare, it was like, wait, we have three terms for one thing and all these acronyms, and people just throw them out. Yeah. And so we have to remember that at the end of this journey is the consumer, is that patient. And I've been in the doctor's office before with my parents where my dad was getting cancer treatment, and they're overwhelmed by the experience. Yeah. My mom was frozen, trying to take in everything that the doctor was saying, but people don't understand. And I'm grateful that I was able to be there as an advocate and say, slow down, let's talk about the details of this, because we can talk in acronyms and in terminology that is just not accessible to everyday Americans.
So true. Yeah. It's like, I think about this task that healthcare marketers and comms leaders have today, which is threading that needle between too much communication, too little communication. And I think we hear a lot anecdotally from consumers and patients that it's often one or the other. You know, alerts that they're muting and they don't want to pay attention to, or they're like, hey, how can I even find this information? No one's communicated with me at all, and I'm in the dark. So to that end, I've got 2 last questions for you. The first one is, from an engagement marketing comms perspective, is there anything you think is going to define 2026? Or is there anything you hope will define 2026?
Yeah, I'll say that the media landscape is in a very interesting place right now, just generally. And one of the trends that I'm paying attention to is outlets are pulling back budgets. And so it's becoming increasingly difficult to get reporters to invest in making trips like this to come to events like Health, where conversations are happening, where a lot of decisions are being made and business deals are being closed. And so it's important that they are there. What we did this year was introduce an influencer program. We understand that to have a comprehensive communications plan, it needs to involve multiple channels. And so that's why with Health, we were one of the early adopters of bringing podcasting into Health and creating a space where we have podcasting booths and space for podcasters to shoot filming content, as well as now an influencer lounge for our influencers to capture content across the event and to be sharing a lot of these experiences and the stories that these companies have to share. So that I'm paying attention to healthcare influencers specifically, because I was listening to a podcast the other day and they were talking about the decreased rate of trust that people have in influencers at large, just because everything's kind of sponsored content. But with healthcare specifically, there is an increase in trust. And I think that's just how people are receiving their news now, you know, or their information. I go to ChatGPT and I go to TikTok.
Same.
But that's how I'm taking it in. And I think that that's very telling of like, there's something about communicating through this channel. And I don't think that we should turn our noses up to it because we think it's Kim Kardashian-esque. It could be very effective, and it can introduce new information to somebody that they can then take to their doctor and advocate for themselves. So that's really where I'm paying attention, is in the influencer
I
space.
couldn't agree more, because I think we've heard a lot in healthcare, like this consumerism of healthcare. Why can't healthcare be more like Amazon, like Google? And of course, Amazon and Google have been players in healthcare for a long time now. But I really agree with what you're saying, and that it's sort of like, I see this next year of healthcare having channel diversification, but almost like the democratization of healthcare, where people are no longer going to like your big branded websites or things like that. They want to hear from people who have similar experiences. And just even if that other person's experience is a little bit different, something they can relate to. And something that feels human.
I also love, I love opening up the New York Times and seeing Maggie Haberman talk about the article or the reporting that she did. I love hearing the reporters come and report live on it too. So like those social posts also have impact for me. So for media too, like they have their place within the social media space.
I totally agree. So I know that we are short on time because health is a whirlwind, so I will let you go soon. But last question for you, is there anything from a health point of view that you want to give a shout out to, anything you want to increase awareness on?
Yeah, we have Vive 2026 happening in LA. So sign up for that. I'll say this about Vive. We have around 9,000 attendees. It's that perfect sweet spot where you have a lot going on the show floor, but a lot of opportunity to make meaningful connections. And so it's going to be a really exciting year. We introduced some new zones this year for health, one of them being diagnostics. We're going to carry that over to Vive. It was really impactful this year. So new programming coming out with Vive.
Love that.
And I would say just keep an eye on that influencer program. It's going to continue to grow with health.
Amazing. Thank you so much. And we'll see all of you in LA for Vive.
Thanks.
Bye.